talk is actually on diabetes, which is a topic I could likely talk about for several hours, but I've condensed it to about 6 slides. Not as sexy as radio frequency ablation and wireless transmitters,
or geriatric care.
But I guess keeping on the subject of food, which is very intimate and related to diabetes. So, briefly talk about, I amazingly found these slides. I didn't know if this talk was going to be bilingual or what, and I ended up finding some slides in both languages. So we'll see how it goes. So I had to thank the Association of Asian Pacific Community Health Organizations that provided these slides. So what is diabetes? Diabetes is a problem in which our bodies aren't processing energy properly. And essentially, most of the energy is converted into sugar. Sugar is the basic form of energy that our organs use, the brain and our muscles. And that can come from carbohydrates from your diet. Carbohydrates are in the form of, or we call them, we no longer use simple and complex carbohydrates anymore. We talk about fiber and simple carbohydrates like that found in rice and sugar and breads, versus carbohydrates that used to be called complex carbohydrates of that found in fiber like beans and certain vegetables. But nonetheless, as the body turns that energy into ultimately sugar, the pancreas, which is an organ around the stomach, makes a hormone called insulin. And insulin is the key that unlocks the door that allows all that energy, that sugar, to go into the muscles and the other cells of the body. But diabetes is a problem in which either there's not enough insulin or a complete lack of insulin. That's actually referred to as type 1 diabetes. We'll get into that in a second. And that's classically juvenile diabetes, is the old term, in which the body makes no insulin whatsoever. But more commonly is type 2 diabetes, and that's where the body has a problem processing the insulin. We like to refer to that as insulin resistance. And that's when the body may have insulin, but it's just not enough to work to get the door open to allow the sugar to come in. The resulting effect then is that sugar rises. Eventually, though, the body tries to compensate by that problem, trying to make more insulin and more insulin. It doesn't work, and then the pancreas ends up puttering out. You can't make enough insulin enough at all. And that's why usually progressive and long-term diabetes ends up with some degree of needing insulin at that point. But there's lots of things we can do to prevent problems associated with diabetes, and we'll get into that. So there's some very powerful long-term studies looking at folks who had diabetes and what happened to them based on different degrees of blood sugar control. We found a certain number of very important things. Diabetes is among the leading cause of blindness in the United States. And that's due to sugar building up and causing damage to the nerve in the eye. But good sugar control can prevent that problem. There's kidney disease and kidney failure. Unfortunately, diabetes is also the leading cause of kidney failure and dialysis in the United States for similar reasons. Essentially, the nerves of the eye and the nerves of the fingertips and some of the distant parts of the body, as well as some of the nerves of the kidney, are very, very sensitive to high levels of sugar. And then there causes a disruption then, and they start failing. The blood vessels in the kidney, blood vessels of the eye, are very, very small blood vessels, and they too are very, very sensitive to the high blood sugar levels. And they also can not function as well, and that leads to these problems. Talk about nerve damage, that's why we classically talk about pins and needles or numbness in the fingertips or in the toes or in the feet. And that then leads to not feeling your toes very well. And if you don't feel them, you don't know if you may injure them. And if you don't know if you may injure them, that can lead to infections. And those infections that may not go noticed can end up leading to amputations. So that's why it's very, very important with diabetes to pay attention to these things, to look at your feet, to examine your feet, take really good care of your feet, to stay ahead, one step ahead of these problems. Diabetes is also associated with increased heart disease, heart attacks, stroke. That's because of the blood vessel problem, again, which the high sugar causes those blood vessels to be very unhappy and prone to inflammation. That inflammation then can lead to an increased risk of developing heart attack and stroke. And the data is pretty solid in the fact that having diabetes is equivalent to almost smoking. That's the kind of increased risk of heart disease having diabetes portends. Again, that risk can be lowered by good sugar control. There's also dental problems associated with diabetes. In fact, dentists are one of my leading referring sources when dentists do a dental exam, they can actually see some of the dental, some of the gum lining and some of the dental disease that's pretty classic for diabetes. So it's also very important for dental care as well, for screening as well as general care. So I briefly talked about the different types of diabetes. So there's mainly two main types. There's a third type as well, gestational diabetes. Quite briefly, that's essentially diabetes only in pregnancy. And it does portend an increased risk of developing diabetes to a small degree. But very quickly, gestational diabetes, normally during pregnancy, the body readjusts some of the hormones, the placenta, secretes some hormones that cause an insulin-resistant state, so the sugar actually goes to the baby and not the mom very much. But in gestational diabetes, that system gets a little too good and causes sugars to rise too much. That's usually a temporary situation. But as I said, type 1 diabetes is people who have diabetes who need insulin every day. Their pancreas does not make insulin at all. Usually it's an autoimmune destruction of the pancreas. And type 2 diabetes, this is the diabetes that is generally weight related. You get it, it's associated with increased weight, obesity, overweightness, and a lot of it can be controlled by controlling what you eat, the type of food, the amount of food, as well as physical activity, working out, regular exercise, very, very important. Most can at least do well on some diabetes pills, but as I mentioned, as the pancreas tries to compensate, it may fall off and then end up needing, not literally fall off, can't take the insulin anymore and need insulin supplementation. So, risk factors for diabetes. Being older than age 45 is a risk. This is for type 2 now. Older than 45, overweight or obese, certainly. Family history, generally say a first degree relative, like a mother or father or a sibling. Having diabetes when you were pregnant, so as I mentioned, having had gestational diabetes increases your risk of developing type 2 diabetes to a degree. And there are certain ethnic groups, Asian American, Pacific Islander, African American, Hispanic, and Native American who live in the Southwest United States, have almost 85% type 2 diabetes. So, learn how to manage your diabetes. So, what types of exercises are best for you? Well, of course, after evaluating your cardiovascular status and state, physical activity, aerobic activity, getting the heart racing, burning energy, getting those muscles all fired up. Aerobic activity is very, very important because the muscles are the furnace that burns your food, burns the energy. If you're not exercising, you can think of your muscles as somewhat like a pilot light of the heater. It's only like it's on standby. But when you're exercising, that pilot light gets turned up like a big bonfire. So if you put a little bit of food on the little pilot light, it just sits there. And it's going to stay there and end up going right here. But if you're exercising, and that pilot light is now a big fire, you put some food on a big bonfire and it burns up. So exercise raises your metabolism, raises your rate of metabolism so you can use energy much more efficiently. Also it has beneficial effects on your overall heart and lots of other things as well. So and burns calories, keeping your weight down as well. Which foods are healthy? I could talk for hours and hours on this, but essentially lots of vegetables, high fiber vegetables, lots of vegetables, lean meats, lean proteins, fish, pork, a little bit of red meat, not too much. Fruits are good, but they're not unlimited. Fruits have a lot of sugar in them. They're natural sugar, but they have sugar. They have a lot of calories. I don't know if anybody does Weight Watchers at all, but the new Weight Watchers now, first a couple of years ago, was that now fruit is point-free. So Weight Watchers works on a point system. Each food gives you a certain amount of points, and you basically cap off how much you eat based on your points. But now fruit is no points. I disagree with that. Fruit does have some points. There is calories. There is sugar in fruit. Fruit in moderation. But essentially, if you think of your dinner plate as a big circle, half that plate should be vegetables of a kind. Then a little quarter of that a protein, and a little quarter of that carbohydrate as well. If you have diabetes, you do need to test your blood sugar regularly. And that's not just to bring to the endocrinologist as your report card of how things are doing, but as feedback as to how did that meal, that portion, and that type of food work on your system's blood, and what was the resulting blood sugar. It's for feedback for you to know, oh, okay, well, this banana really raised my sugar a lot. Next time I need to avoid the banana and choose something else. But it also gives you an idea of your overall blood sugar when we talk about the goals of where your blood sugar should be. take your medicine correctly. There's a lot of new diabetes medications. It's hard to keep track of different kinds, and they all work differently. They all work together in certain ways. It can be confusing, and so you want to be very clear on making sure you're taking your medicines correctly. Sometimes when you say half a pill twice a day, one pill a whole day, it can get a little confusing, and you just want to make sure you're taking it correctly. You also want to see your doctor regularly. Generally, you want to see if you're ever managing your diabetes every 3 or 4 months, as well as your foot doctor at least once a year or more frequently. Your eye doctor once a year, so you can do that eye exam, looking at the nerve in your eye as well. So to control your blood sugar levels in general, of course, a healthy diet, kind of like what I was talking about before, regular physical activity, taking your medicines, seeing your doctor, testing your blood sugars, emphasis on exercise, keeping your weight down. Now, of course, there are genetic factors that run in families that may cause you to have diabetes despite being thin already. So not all type 2 diabetes is from overweight or obesity. In fact, I've seen a lot of my, significant portion of my Korean type 2s are not exactly all heavy. And there's definitely a genetic factor going in that. And losing weight more so doesn't actually always improve the problem. So that's a tricky type of diabetes. So every 3 months or so, there's a blood test that should be drawn called the hemoglobin A1C. It's related to hemoglobin, but it's not that test. Although you have to have a normal hemoglobin for this test to be accurate. That's that blood count number that tells if you're anemic or not. So good control is considered a hemoglobin A1C blood test of around 6.5 or 7%. That is an equivalent to an average blood sugar of 2 or 3 months of about 120 to 140. That's the target. Though that target has been associated with fewer of those complications I mentioned earlier about the eye disease, kidney disease, heart, lung, nerve problems. So that's why we shoot for an A1C of under 7%. Now it's variable. That target can change based on your particulars as well. But generally, if you're younger side, healthy side, you'd like to be more aggressive about keeping that A1C lower. But there are certainly circumstances where on the other spectrum, very old, the elderly, where we may be more lax about that goal, because the more aggressive you are about lowering it, there may be more complications like low blood sugar. You don't want low blood sugar either, with blood sugar in the 50s, 40s. That can be dangerous as well. So this is the package of good diabetes care, good comprehensive diabetes care. Blood pressure checks. You want your blood pressure to be under 130 over 80. That's the target for fewer complications. Cholesterol tests. There's lots of different types of cholesterol. That big cholesterol panel that we often get. There's total cholesterol. There's LDL cholesterol. There's HDL cholesterol. Triglycerides. Get a little complicated, but the most important one out of the whole panel is called LDL cholesterol. That's the kind of cholesterol that blocks the arteries and causes strokes and heart attacks. And if you have diabetes, you really want to work very hard making sure that LDL is under 100. Very, very important. Foot exams, as I mentioned, eye exams, the kidney test. The doctor should also be ordering a urine test at least once a year, and that's looking for protein in the urine. That's the earliest sign of that kidney damage. And so we look for that protein in the urine, and that can guide us to be more aggressive about preventing that problem, and dental exams. So I think this just reiterates what I was saying about type of diabetes, regular care, diet, exercise, check your blood sugar, and keep a log of your blood sugars. When you come to your doctor, look at them. That's very, very helpful in helping interpret things. And if you do all these things, keep the blood sugars